In Geneva, Switzerland, is Mario Ottiglio, a global health policy expert, also the managing director of the High Lantern Group. Welcome to the program, Mario. During times like we're living through now, when the world faces a collective health challenge, how important is it that there's one global body, and how good a job has the WHO been doing being that body?
Good evening, Adnan. Absolutely. How important? It's very important. The WHO, for a lot of country, it's basically remains the best hope. Because if I said it once before, if it did not exist, it would need to be really invented. I think we are in a critical juncture. I was looking at the package just before my interview here, and it's a great moment, I think, for governments to really reflect and to take the opportunity to decide to pay more to support these organizations. I see a couple of reasons. We have seen the nationalistic tendencies. Once you don't have really like a strong coordinated body. These are unavoidable anyway, even with a strong organization in place. But I think it's a very important insurance to have WHO there, and less money will marginalize and weaken WHO. And I think also there is a lot of unfinished business. I mean, it is not just about COVID. It is a lot about COVID, but WHO is doing a lot of important work during the year, if you want, improving maternal health, rolling out a routine immunization program, propping up healthcare system. So it is an important organization, and it should be even stronger.
Yeah, I just wonder, as it faces this massive shortfall in funding, whether its record on the pandemic may actually be the deciding factor when countries decide to step up, because, of course, as the report said there, that it relies solely on donations. And it appeared to be a bit of a reluctance not to declare COVID-19 a pandemic. There were some people saying that because Dr. Adhanom, the Secretary General, Director of the WHO, maybe owes his job to China, that he didn't want to push the investigation too far about the origins of COVID-19. Then there was a long delay in the WHO declaring the pandemic and the virus itself to be an airborne virus. So these are negatives against the WHO's record, do you think?
Well, I mean, there is a lot of discussion still ongoing, right, on exactly how this was managed and, how better the WHO can be in doing that. But I think, when it comes to COVID and WHO, I think it's a shared responsibility because, yes, definitely there was some, negative vibes, as you suggest. But I think that, one of the things that COVID has taught us is actually that the value that we place on healthcare needs to be reassessed, because basically, we were not prepared. And, WHO could have done better, but the governments could have done much better. I mean, now we are paying billions to respond to a crisis like COVID. But actually, if you think in the investment terms, billions are nothing compared to the trillions that actually we are paying in various bankruptcies, in job losses, in various, super special packages that the governments are doing, not to mention, people that die, that are still sick, and not to mention people that will be sick from long COVID. So I think, yes, it's a moment of reflection, but I think it's a moment of reflection as an opportunity to finally understand that we need to invest more in healthcare, in pandemic preparedness, because we need solid basis, right, going forward when the next crisis will come.
Quite possibly the WHO's best counter-argument to what I've just said, Mario, might be that, look, if you leave it to the richest countries in the world to try to sort out global health problems, look at COVAX. That whole plan to give developing countries vaccines, and there's still 3 billion people in the world who haven't received a single dose, and rich countries are going ahead, some even giving a 4th dose. What is the situation, as far as you're concerned, regarding the unvaccinated in developing countries and the danger that poses to the richest countries that are giving even 3rd and 4th doses?
Yeah, we have seen a little bit of that, right, with the early days of Omicron, where actually there was this overreaction by, if you want, the Western world into closing of the borders, right? And there was a lot of things on the news about the fact that actually global cooperation should be encouraged, and you should not react by just closing borders and having this kind of cagey attitude. But this brings in the overall conversation around healthcare system strengthening. and WHO's critical role into that. I mean, clearly there is, one kind of big, mindset shift that we really need to kind of continue foster at global level, which is like trying to address as much as possible this kind of, nationalist tendencies. But there is also the other point of needing to build the basis, needing to allow WHO to actually continue to work with its partners, because there are, of course, also partners for that, into healthcare system strengthening, to making sure that the countries that are most in need have actually that infrastructure, that supply chain that is able to absorb, innovations, anything that, will come also in an emergency crisis. And I think, it's there the balance to be found in the next conversation. I think this is going to definitely carry on until the next, spring, when they will meet again to discuss on the WHO assembly.
Mario, we always appreciate your input. Thank you so much for taking the time. Mario Ottiglio in Geneva.
Thank you.